Hi, I'm Dr. Shane Howell, and I'm going to show you my neck, upper back, and shoulder routine that I personally do, and I recommend it to my patients to help improve their posture, flexibility, function of those areas. So I usually start out with some just simple range of motion exercises, which with the neck it's forward and back. I count to 10, so 1, 2 to 10, and I go side to side, so 1, nice and easy, I'm not forcing it, to 10, and same thing, rotation, 2, 3, 4, count to 10. Then I do the shoulder rotation and range of motion, so I go forward and back, count to 10, then I go in and out, or up and down, count to 10 that way, and I go in and out, count to 10, and then I do rotation of the shoulder, like in the joint itself, because it's a ball and socket joint. So I put my hands up like this, and I go thumbs, watch my hands and thumbs, so I'm thumbs going down, and thumbs going back, thumbs going down, back, and trying to keep my arms where they're at. Like that. So I rotate my hands as I do it. I do that 10 times. Then the next thing I do is I take a foam roller. It's like this. They sell them everywhere, Academy, Target, Walmart. Doesn't have to be a fancy one. They're pretty cheap. And I lay it down on the ground. And I put it above my low back. So not on the lumbar spine, but above it. Just place it there and I kind of lay back over it. Essentially kind of like a sit-up position. I just let my body kind of hang over. Hold it 10 seconds. Then curl up. Let the foam roller roll up just a bit. Do the same thing. Count to 10. Curl up. And just keep working my way up through my spine. When I get all the way up to my shoulder blades, I pull my hands up to pull my shoulder blades out of the way, otherwise they're going to be in the way. So same thing. And I stop just before I get to the neck, the base of the neck. And then I work my way back down. And essentially what this does is help kind of normalize the position of your spine and reverse that extra flexing that a lot of people develop with bad posture. Put that away. So the next thing is a combination of stretching and contracting the neck and the shoulders. So the neck, what we do is I'm going to pull the head down just a little bit, put my hands down, and just gently stretch. I'm stretching the back of the neck. I'm not doing it excessively, just a little bit of a stretch. And I hold it about 10 seconds as I breathe. After 10 seconds, I reverse and go the other direction. I'm going to push against for 3 seconds. 1, 2, 3, and then I stretch it again. I'm pushing down with my hands just gently, stretching it a little more. Then I go back, and I'm just gently, I'm pushing this, adding a little more stretch to it for 10 seconds. And then I'm going to reverse it and push against. I'm pushing against my head to add a little contraction for 3 seconds. Then stretch it again. Then I'm going to do the same thing with the sides. So usually what I like to do is grab something like a heavy table or a counter or something like that. I'm going to grab it so I can hold my shoulder down, and I'm going to kind of pull away. So it's going to stretch it a lot better. I'm taking my hand and pulling my head gently this way. Hold it about 10 seconds. Then I'm going to relax, tilt my head the other way, and push against my head for 3 seconds. 1, 2, 3. And then stretch it again. I'm going to do the same thing on the other side as well. Then I'm going to do rotation, which is rotating my head. Take my hand and I'm going to add a little more stretch to it. Hold it for 10 seconds and relax. I'm going to go the other way. I'm going to take my hand on the other side and push against it, resist against my head. And relax and stretch it again. I'm going to do both sides. Then I'm going to stretch the shoulders. So best thing to do with that is to get a door frame. So come on right here. I'm going to put my arm touching the door frame. I'm going to kind of rotate around. So I'm going to stretch basically the front of my shoulder all the way, this muscle that connects with your sternum or your chest bone. I'm just going to hold it for 10 seconds. Then I'm going to relax, contract it, which is bringing my arm across my body, 3 seconds. Stretch it again. Then I'm going to do both sides. Then I'm going to do the opposite side of my shoulder. I'm going to show you this side. So I'm going to take the arm, palm in, and pull away. Hold it for about 10 seconds. Then I'm going to contract it. So I'm going to pull it back the other direction and tighten it for 3 seconds. Come back and do it again. Okay. Then I'm going to do both sides. Okay. The next thing I want to do is put my arm on the wall. Like that. Arm is nice and straight. And what I'm going to do is kind of rotate my arm back and forth. This helps to kind of mobilize the capsule, the tissue right around that ball in my shoulder. I'm going to count to 10. And at 10, I'm going to stop at one end and count to 10 from this position. Count to 10 the other position. 1, 2, 3 to 10. And then I'm going to do both sides. Then I'm going to take my hand like this. And a lot of people cannot get all the way. They might have to do it down here and even not fully rotated. But you want to get to a point to where you can put your hand straight out from you and just do what you can. And I'm going to do the same thing. Rotate my shoulder to 10, and then I'm going to hold it, rotate it one way, and rotate the other way. So it's going to really work and mobilize the shoulder right in that joint, as well as that one's going to really get stretch all this. You'd be surprised at how tight it gets because we're on our phones and computers and driving and everything. So next thing I'm going to do is I'm going to take one of these balls. You can get these just about everywhere as well. You can get them at Target, Academy, Walmart, and so forth. So I'm going to put that down on the ground. I'm going to show you 2 different versions of it, and you can start with an easy one, which is you're on your knees and just make sure you straighten your body out. You're going to put your forearms on it. Okay? And what you want to do is pay very close attention to my upper back and my shoulders. I'm going to push my body up. Okay? I'm going to hold that the whole time I'm doing this. And I'm going to circle it 10 times this way, then 10 times reverse. Okay? And then I'm going to go full in and out, in and out. Then I'm going to go side to side 10 times. Very important that you're pushing up through your back the entire time. Don't let your body collapse, because that's what we're trying to do, is work on the scapular stability. Put that away. And then I take something like this. This is the ones I recommend. It's like a big, giant rubber band, thick rubber band. You can buy these. I've seen these at Target, at Academy. You probably want to buy the least resistance one. They're usually color based, and they'll tell you the amount of resistance. So you want one that's relatively light, because they'll give you a little more options. And the thing is, the further you pull it away, the harder it gets. So the main things I want to focus on is a pull and rotation in the shoulders. We're trying to get the body to where the posture is here versus here. So I basically tie this into anything that's very stable. You usually don't want to tie it into a door unless you can lock the door. Otherwise it's going to pop and hit you in the face. So essentially what I do is I'm going to do a kind of a combination of like I'm squeezing my shoulder blades back and together like that, without extending my whole body. So I'm maintaining my body and just squeezing my shoulder blades together. And then at the same time, I want to, it's like I'm pulling my arms and thumbs back as well at the same time. And then from there, I'm going to pull my kind of the opposite of shrugging my shoulders. I'm going to pull my shoulders down. I'm going to hold that as long as I can hold it, essentially. And I just make sure I breathe. And what that's really doing is really working those muscles because they get very weak. Because again, we're on our computers and on our phones, pulling them out all day long. So another option, a more advanced way of doing it, is to get on the ball and do that. And so what I do is put my belly button right about the ball, tighten my glutes, that protects my back, and then I'll use this resistance and hold it and pull and do the same thing in that position. It's a little more difficult, but you can start with the standing position there. The next one, so that works the back, and we want to work the front, is to do kind of a push-up. You can do a modified push-up, which is basically on your knees. Just make sure you have a nice padded floor. You don't usually want to do this on a tile floor or a hardwood floor, unless you have like a pillow or down for your knees. I'll lower myself. This is real important. It's like just like you did the exercise with the ball. You're going to push up through your upper back and hold that the whole time. And then to do the push-up right, you want to kind of keep your elbows in a little bit. You don't want your elbows flaring out. And so I'm just going to bend my elbows, keep pushing up through my back the whole time. The mistake a lot of people make is they'll let their shoulders collapse. That's the incorrect way. And then they'll let their elbows flare out. You're going to tear your shoulders up doing that. So keep your elbows in and push up through your back. Just like that. So obviously a normal push-up that I would do is like that. Knees up. Same thing. And another way I do it sometimes is to put my hands on the ball and do it from there. So it adds a whole new layer because I have to balance myself to do it. And just start out with what you can handle. Okay? And so the last thing I do is a form of a plank where I'm working on my range of motion of my shoulders. So a plank, you can do a modified or a very easy version of the plank, which is for this one I use an extended arm, like a push-up position. And then what I'm going to do is try to stabilize my body. I'm going to lift my arm, go back and forth 10 times. 1, 2, count to 10. Then put my hand down. I'm going to do the other side. 1, 2, count to 10. Then I'm going to go in to out. Count to 10. Count to 10. And then forward and back. And count to 10. Obviously the harder version of that is knees are up. And it's it's harder because you're trying to stabilize. Your body's going to want to tilt over. You got to maintain your body as straight as you can, because that's part of the process. And what I do essentially is add that with the other routine that I have for my back and hips, and I do it every day because it keeps my posture, my flexibility, everything really healthy, and I don't have to worry about my back going out, my shoulders and neck going out. Okay.